Today I have a 26-year-old male client coming into the clinic who has Ehlers-Danlos syndrome. Now today we are going to be undertaking the Beighton Test for the reason that we can assess their risk of joint dislocation around the whole body as he has excessive joint hypermobility.
Hey, thank you, Nick, for coming in today into the clinic. Now, today we're going to do a Beighton test. Have you had a Beighton test before? No. Okay, so what you'll experience is we're going to put the joints in the hyperextended position, and you'll probably experience tightness around the joint while you're doing the test. Now, because you have Ehlers-Danlos syndrome, we're going to make sure that we do this test slowly and cautiously as you are presented with pain during the movement, and you can have a possibility of dislocation. Now, this test does put you in the risk of or the opportunity to dislocate, so we're going to take our time and we're going to make sure you don't need to pass every test. We're just seeing how far each limb can move. Now, the benefits of this test is that we can assess the risk of you dislocating, genuine dislocation around the body during exercise. An exercise prescription will just be changed a little bit depending on the score. Now, do I have your consent to proceed?
Yes.
Okay, so the first test is fairly simple. We're going to have our arm flat on the table, and we're just going to get our little finger, and we're just going to bend it up as far as we can. Remember, you don't need to just go to the lengths as where you can extend it. Don't go any further or less. Okay? So I'll get you to do that on both hands. Yep. Okay, other one. Thank you. Now what I'm going to do is I'm going to get you to have your arm up, and we're going to touch the bottom of our forearm with our thumb. So you're going to do this passively, and we're going to touch it. Okay? Yep. Now on the other hand. Okay, great. The next test, involving going normal. So what I'll do is to stand up and just put your hand out straight and try to get it straight as you can. Try to bend it as you can. Now have you felt any pain so far? No. Each of the tests? No? Okay. I'm lining it up with the acromion process to the radius, and we're going to get 10 degrees of height extension of the elbow. Okay, now we're going to do it on the opposite limb. Same process that we did before. We're going to line it up to the acromion process, and we'll put on the radius. Okay, again, 10 degrees of elbow extension. Now, just record the results. Okay, so the next test is we're just going to straighten our knees, and we're going to try to touch our palm on the floor. Try to keep the knees bent, extended at all time. And just before we start, did you have any pain in any of those tests at all?
Slightly in the left elbow, but nothing severe.
In the left elbow?
Yep.
Is that when you started to hyperextend it?
Yes.
Okay. Sweet. Thank you. So we're going to perform this test. Remember, straight legs, and just try to touch the floor using your palms.
No worries.
Okay?
Go.
Yep. Okay, great. No pain at all?
Yeah.
Okay. Okay, now I'm going to use the same process of going on, but on your legs.
Yep.
So what I'm going to get you to do is try to extend your knee as far back as possible. So we're going to line up the greater trochanteric line to your knee, to your lateral malleolus, and we're going to have, oh great, 10 degrees of extension in the knee. Now opposite side, try to get as far back as you can without any discomfort. Again, retrocanic line, down through the knee to the lateral malleolus. Okay, 10 degrees of knee extension. So total, you have got 8 out of 9, and it's clinically significant if you score more than 5 points. So you are going to be at risk of dislocation. Therefore, our exercise that we do for your populations, we like to focus on proprioception and balance, and closed kinetic chain exercises. So thank you for coming in.
Thank you.